I'm Beverley Bryant, Director of Strategic Systems and Technology at the NHS Commissioning Board. I joined on the 1st of January this year, so about 8 weeks. And it's a really, really exciting time. You may be aware of Tim Kelsey joining as National Director for Patients and Information. And he has been talking about our ambition, which I'll just reiterate. But I think what people need now is more detail. What do we really mean by that? How are we going to do it? Now, I'm not ready to launch what we're going to do yet, 8 weeks in. I want to be clear and know what I'm doing, but I am able to provide a little bit more clarity as to what we mean. I think it's fair to say that the mandate from the Department of Health to the NHS Commissioning Board, the planning framework that went out, the backing of the Ministers, Secretary of State, the Cabinet Office, number 10, means that if we can't do this now, we're never going to do it. There feels politically like there's a real drive behind this. And so what will start to happen over the next few months is a call to arms, starting off at Expo, moving on through the summer, to NHS employees, to clinicians, to the public to get behind this agenda, because frankly we aren't going to do it without the collective efforts of everyone. So I just want to start by, the two things I'm just going to touch on today are paperless NHS and digital patient records. There's two small areas. I think it's also worth saying, and I did promise the colleague that I would mention, that part of my role is to create a vision and a strategy for technology in the NHS for the next 10 years. That means driving out more work for small and medium enterprises, help to stimulate growth and help train and support a workforce from a leadership perspective so that they feel supported and helped. I am not interested in issuing guidance and instructions that we then sit and performance manage through to a conclusion. It's got to be much more about saying, here's what people are doing over there, come and have a look at the innovation here, here's how you can learn how to do it for yourselves, etc., etc. I haven't got time to go on about that today because someone's going to shut me down in 15 minutes if I go on too much about that. Just in terms of paperless NHS, specifically in the first instance, we're talking about paperless referrals and electronic referrals in particular. The point is that we have a situation through the current national systems that 50% of referrals are managed on paper and 50% are managed electronically. That is the worst of both worlds. The reality is that patients, the public, may always need paper. We are not going to prescribe that patients will not receive letters. But what we want to do is to move to a digital NHS where if a patient would like an email or an SMS reminder of their appointment, or would like online to change an appointment, then we as the NHS need to equip ourselves to allow that to happen for patients. We need to make it easier to do business with the NHS. It feels difficult for the basic systems and processes around things like managing appointments, and so we are committed to try and get that right. That's complicated. We need to take clinicians with us. There's a number of functional issues associated with current systems that make it difficult for GPs and difficult for hospitals to deal with that. And so it won't be enough to meet the needs of patients. We need to meet the needs of clinicians, and we need to meet the needs of managers. And so everyone feels that the new systems and the way of working is going to work for everybody. So again, we're busy developing our plans, and we're looking to launch much more detail about what that means in about May or June time. The next biggie is digital records. We have had a mixed position through the national programme of national systems looking at digitising records, and lots of really good work going on at a local level with some really good integration and interoperability between electronic records in some pockets in the country. We do actually have quite a large amount of interoperability in some areas, except it's not extended to ambulance, so we're not fully there. But The approach we're going to take is going to be mixed. We're going to be taking a national stance around standards, interoperability, for example, use of the NHS number. It's never going to join up if everybody just goes off and does their own thing. But what we're not going to do is dictate exactly how to do it. We want there to be local ownership. So we're busy looking at a policy or an announcement that actually says, how can we, and the number of times people have said to me that there's innovation in pockets, you know. The job is to spread the good practice that's happening in one area and spread it out to others, but within the context of some national standards and national ways of working that people can sign up to and feel are not overly bureaucratic and onerous, because there's also a sense that it's actually quite difficult at the moment, for example, to break into the market because of the thousands of rules that people have to subscribe to in order to be connected. So I think that's really it in a nutshell, that you know, we've got to drive forward a digital NHS, and the strategy that we're developing now, we're hoping to publish towards the end of the year, really will try and encapsulate that and get the best of what's come out of the national systems, whilst at the same time develop ownership and drive from the clinical community. Always, importantly, in the back of our minds, in the front of our minds actually, that why are we doing this? How is this improving things for patients? How are we making it easier to do business with the NHS? So that's me. Any questions?
Beverley, you talked about referrals there, and I work in primary care. You've got a choose and book system, and patients can change their appointments online as it is. So what sort of changes and improvements are you going to have to that system then?
Well, at the moment, there are a number of functional enhancements that the team are aware of that would help make it easier. For example, any-to-any referrals, other just embedding the functionality within existing systems. There's some clunkiness and difficulties that clinicians have told us, GPs and hospitals, that would make it easier to use and quicker to use. So whilst we're refreshing the technology and looking at building in those enhancements, we're actually going to see about how we can add on some user-friendly functionality that actually helps for patients. So for example, using SMS text to remind people. A lot of local organisations have done this, but it's not actually embedded within the current system. So we're taking a much more holistic approach. 10 years on, is choose and book now what we need going forward.
Hi, I'm Steve Clare, I'm a GP. One of the biggest problems that we have is communication between computer systems. And although lots of things are supposed to be driven from the bottom up, there's one thing that could really help us from the top down, and that's making it a prerequisite that computer systems talk to each other. For example, System 1 and EMIS Web. You know, if one of the prerequisites for them to get paid by the NHS was that they had to talk to each other, it would stop certain computer companies, naming no names, deciding that they won't let their system talk to the others. So
the strategy, if we're going to achieve an integrated health record, and all our other agenda around openness and transparency of data, then we need to have openness, open APIs to allow data to be interchanged. Yeah. We're in negotiation at the moment through the GP SOC 2, which is currently in discussion, which we're scheduling to have concluded by November, to deliver just that.
I love you, Beverley.
Can we finish there? I like that. Brilliant. Thanks very much. Cheers.